Welcome to the course Biomedical Instrumentation and Sensors. Your course coordinator Dr. Pankaj Kumar Mishra, currently working as a professor in the Department of Electronics and Telecommunication at Rungta College of Engineering and Technology, Bhilai. Today, we will discuss the time frequency analysis. The time frequency analysis is a signal processing technique used to study and represent how the frequency content of a signal changes over time. It provides a way to analyze signals that are non-stationary, meaning that their characteristics evolve or vary with time. Unlike traditional Fourier analysis, which assumes constant frequency components over the entire signal duration, time frequency analysis techniques such as the short time Fourier transform, STFT, wavelet transform and others offer a dynamic view of how the signal's spectral content fluctuates throughout its duration. This allows for the identification of transient events, tracking of frequency changes and a more comprehensive understanding of complex signals, making time frequency analysis invaluable in various fields, including biomedical signal processing, audio processing and communication systems. Time frequency analysis in biomedical signal processing. In this lecture, structure effectively highlights the need for time frequency analysis in understanding complex signals by emphasizing the challenges posed by non-stationary and showcasing real world application across various domains. Time frequency analysis in biomedical signal processing is a critical technique used to extract and analyze dynamic information from psychological data. This approach is necessary because many biomedical signals are non-stationary, meaning their characteristics changes over time. Time frequency analysis methods help reveal how the frequency component of these signals evolve, making it easier to understand their underlying psychological processes and extract valuable diagnostic information. Time frequency analysis is used in electroencephalography, EEG and magnetoencephalography MEG to study brain activity and cognitive processes. It allows us to analyze the frequency content of brain signals at different scales, providing insights into brain functions and dysfunction. Biomedical signals are vital in healthcare and research. In summary, time frequency analysis is indispensable in biomedical signal processing because it allows us to capture the dynamic nature of these signals, extract meaningful information, improve diagnosis and treatment and advance our understanding of human psychology and pathology. It plays a vital role in healthcare research and development of personalized medical intervention. Time frequency analysis is crucial in the field of biomedical signal processing for several reasons. First one, detection of transient events. Many important events in biomedical signals are transient, such as spikes in brain activity or abnormal heart rhythms. Time frequency analysis can identify and characterize these events by showing how their frequency component changes over time. Second one, non-stationary signals. Biomedical signals are typically non-stationary, meaning their statistical property change over time. Time frequency analysis techniques like wavelet transforms or the Wegener-Weyl distribution can adapt to these changes and provide a more accurate representation of the signal's behavior. Third one, dynamic nature of biomedical signals. Biomedical signals such as EEG, ECG and EMG are inherently dynamic. They change over time in response to various psychological and environmental factors. Traditional time domains or frequency domain analysis often assume stationary, which does not capture the full complexity of these signals. Time frequency analysis is designed to handle this dynamic nature. Next one, denoising and feature extraction. Time frequency analysis can be used to denoise signals by filtering out unwanted noise components in the time frequency domain. Additionally, it helps in feature extraction, allowing researchers to extract relevant information for further analysis or classification task. Fifth one, diagnosis and monitoring. Time frequency analysis is critical in healthcare for diagnosing medical conditions and monitoring patient health. For example, it helps in identifying abnormal brain patterns in EEG data, detecting arrhythmia in ECG signals, or analyzing muscle activity in EMG recordings. 6.1 Research and discovery. Researchers use time frequency analysis to uncover hidden patterns and relationship within biomedical data. This aids in understanding the underlying psychology, exploring new biomarkers, and developing better diagnostic and therapeutic method. 7th one, personalized medicine. Time frequency analysis can contribute to personalized medicine by tailoring treatments and interventions based on an individual's unique psychological responses. It allows healthcare providers to make precise decisions about patient care. 8th one, real time monitoring. In critical care setting, a real time monitoring of biomedical signals is essential. Time frequency analysis can provide immediate insight into a patient conditions, enabling rapid response to changing health states. Next, 9th one, that is integration with machine learning. Time frequency features extracted from biomedical signals can serve as input features for machine learning algorithm. This integration enables the development of predictive models for disease diagnosis and treatment planning. Scientific advancement. Advancement in time frequency analysis technique contribute to our understanding of complex biological system. This knowledge can lead to breakthroughs in medical research and the development of innovative healthcare technologies. Cross disciplinary explanation. Time frequency analysis technique are not limited to biomedical signal processing. They find applications in various fields, including speech processing, audio analysis, geophysics, and many more. Time frequency analysis techniques. Time frequency analysis techniques are essential tools in signal processing for analyzing the time varying frequency content of signals. These methods provide insights into how the spectral characteristics of a signal change over time, making them valuable in various applications. Here are some of the key time frequency analysis techniques. First one is short time Fourier transform, STFT. The short time Fourier transform, STFT, is a time frequency analysis technique used to overcome the challenges posed by non-stationary signals. It involves dividing a signal into short overlapping time segments and computing their Fourier transform for each segments. The result is a time varying frequency analysis, providing insight into how the signal's frequency content evolves over time. Advantage of STFT. Time localization. STFT offers excellent time localization, allowing the capture of transient events and changes in signal characteristics. Adaptability. It is well suited for analyzing non-stationary signals, making it a versatile tool in biomedical signal processing. Spatial information. STFT provides both time and spectral information, offering a comprehensive view of signal dynamics. Now, limitation of STFT. Fixed time frequency resolution. The resolution of STFT is fixed, which means you must choose a compromise between time and frequency precision. Window selection. The choice of window function can impact results, and selecting the right window can be challenging. Trade off. There is often a trade off between time and frequency accuracy. High time resolution may result in reduced frequency accuracy and vice versa. Application examples in biomedical signal processing. EEG analysis. STFT is used to analyze EEG signals to track changes in brainwave pattern, which are crucial for diagnosing conditions like epilepsy or sleep disorder. ECG signal analysis. In ECG analysis, STFT helps identifying transient irregularities in heartbeats, aiding in arrhythmia detection and diagnosis. Voice analysis. STFT is applied to voice signals for detecting speech disorder and tracking changes in voice characteristics over time. MRI signal processing. STFT can be used in MRI signal analysis to study changes in tissues characteristics over time, aiding in disease diagnosis and monitoring. STFT is a valuable time frequency analysis tool in biomedical signal processing. It provides insight into non-stationary signals, offering excellent time localization and adaptability. While it has limitation, its advantage make it a crucial technique in various biomedical applications. Now, next one is continuous wavelet transform. Continuous wavelet transform is a powerful time frequency analysis technique that provides a high resolution representation of signals components at different scales. Here are the key features about the CWT, that is continuous wavelet transform. The CWT is a mathematical transform used to analyze non-stationary signals by varying the scale and position of a wavelet function. It captures how the frequency content of a signal changes over both time and frequency. Wavelet function. In CWT, a wavelet function is chosen, which is typically a short localized waveform. Common wavelet function include the Morlet, Maxian, Hat or in bracket Ricker and Haar wavelets. The choice of wavelet function impacts the analysis, scale and time. The CWT analyzes the signals at different scales and time positions. Smaller scales capture high frequency details, while larger scale capture low frequency components. This provides a multi-resolution view of the signal. The discrete wavelet transform DWT is a powerful signal processing technique that decomposes a signal into different scales, revealing both high and low frequency components. Here are some features about the DWT. Multi-resolution analysis. DWT is a part of multi-resolution analysis, which means it decomposes a signal into various levels of detail or resolution. Each level provides a different view of the signal, capturing details at different scales. Two components. DWT involves two components, the approximation coefficient and the detail coefficient. Approximation coefficients are the low frequency information and detail coefficients are high frequency information. These components represents different aspects of the signal's content. Then orthogonal or bioorthogonal wavelets. DWT uses wavelet function that can be orthogonal or bioorthogonal. Orthogonal wavelets are symmetric and results in a perfect reconstruction of the original signals. Bioorthogonal wavelets allow some flexibility in balancing reconstruction accuracy and computational efficiency. Decomposition and reconstruction. DWT decomposes a signal by applying a series of high pass and low pass filters followed by downsampling or subsampling at each level. Reconstruction is achieved by applying an inverse process using high pass and low pass filters followed by upsampling. Time frequency localization. One of the significant advantages of DWT is its ability to provide time frequency localization of signal components. This makes it well suited for analyzing non-stationary signals and detecting transient events. Applications. DWT finds application in various fields including image compression, denoising, feature extraction and biomedical signal analysis. In biomedical signal processing, DWT is used for ECG denoising, EEG analysis and detecting abnormalities in signals. Scalability. DWT's multi-resolution approach allows us to choose the level of detail that we want to analyze. It is computationally efficient and scalable, making it suitable for real-time processing and handling large data sets. Limitation of DWT. While DWT is a powerful technique, it may suffer from some loss of information during decomposition and reconstruction. The choice of wavelet and decomposition levels can impact the results. Now, the continuous wavelet transform versus discrete wavelet transform. DWT is a discrete version of the continuous wavelet transform. CWT provides continuous time frequency information, but it computationally more intensive. In summary, the discrete wavelet transform is a versatile technique that allows for signal decomposition into different scales, enabling the analysis of both low and high frequency components. Its application in various fields including biomedical signal processing highlight its effectiveness in capturing important signal features. Understanding the choice of wavelets and decomposition levels is crucial for optimizing DWT based analysis for specific tasks. Wigner-Willy distribution. The Wigner-Willy distribution is a time frequency analysis technique used to obtain a joint time frequency representation of a signal. Here are some key features about the WVD. Time frequency analysis. The WVD is a tool for analyzing non-stationary signal which changes their frequency content over time. It provides insights into the time varying spectral characteristics of a signal. Joint time frequency distribution. Unlike the Fourier transform, which provides a static frequency analysis, the WVD captures how the frequency components of a signal evolve over time. It offers a joint time frequency distribution, revealing the signal's energy distribution across time and frequency. Mathematical definition. The WVD is defined as the bilinear time frequency distribution of a signal xt, and it is typically represented as W is a function of t and f. It is computed using convolution like operations between xt and time reversed version of xt with a time lag parameter. Energy concentration. The WVD shows where and when the energy in a signal is concentrated in time frequency plane. Peaks in the distribution indicate dominant frequencies at a specific time instant. Cross term. The WVD includes cross terms which are a major drawback. Cross terms are interference patterns that can make interpretation challenging. These cross terms arise due to the bilinear nature of WVD and can obscure the representation. Application: the WVD is used in various fields including radar signal processing, speech analysis and biomedical signal analysis. In biomedical signal application, it aids in analyzing EEG and ECG signals to identify transient events and changes in frequency content. Improved time frequency resolution: the WVD provides better time frequency resolutions than the Fourier transform. This makes it suitable for analyzing signals with rapidly changing frequencies. Limitation: the presence of cross term can complicate interpretation and may require additional processing steps to mitigate their effects. Computationally, the WVD can be more intensive than the Fourier transform. Advanced technique: to overcome some limitation of the standard WVD, various modification and smoothing techniques have been developed, such as smooth pseudo Wegener-Wille distribution SPWVD. In summary, WVD is a valuable time frequency analysis tool for understanding how the frequency content of a signal changes over time. Its joint time frequency representation provides insights into the signal energy distribution and dynamics, making it useful in various fields including biomedical signal processing. However, its susceptibility to cross terms and computational demands should be considered when applying the technique to a specific application. Now, Hilbert-Hung transform HST. The Hilbert-Hung transform is a powerful time frequency analysis technique used for extracting intrinsic mode function and obtaining a high resolution time frequency representation of a signal. Here are some key features about the HST, that is Hilbert-Hung transform. The introduction to HST. HST is a relatively recent and adaptive technique used for analyzing non-stationary and nonlinear signals. It was developed to address the limitation of traditional methods like the Fourier transform. Intrinsic mode functions. The core concept of HST is the decomposition of a signal into IMFs, that is intrinsic mode functions. IMFs are functions that capture the local oscillations or components of the signal. They are extracted based on the empirical mode decomposition algorithm, which iteratively identifies the dominant oscillatory modes. Adaptive approach. HST is adaptive and data driven, meaning it adapts to the inherent characteristics of the signal. It adjusts the decomposition process to capture the varying frequency content over time. Time frequency representation. HST provides a high resolution time frequency representation of a signal. It reveals how the signal's frequency component changes over time, make it suitable for analyzing non-stationary signals. Hilbert spectrum. The Hilbert spectrum is a central component of HST, representing the energy distribution of IMFs in the time frequency plane. It offers insight into the signal's time varying spectral content. Now, application of HST. HST finds application in various fields including vibration analysis, speech recognition and biomedical signal processing. In biomedical signal processing, it is used for EEG analysis, ECG feature extraction and detecting transient events and signals. Advantages of HST. The HST excels at capturing transient events, abrupt changes and nonlinear features and signals. It provides superior real time frequency localization compared to the traditional methods like the Fourier transform. Limitation of HST. HST may require careful parameter tuning and its performance can be sensitive to noise in the data. Interpretation of IMFs may sometimes be challenging due to the adaptive nature of the techniques. Improved versions. Various enhancement and extension of HST have been proposed to address and limitations such as ensemble empirical mode, decomposition and complete ensemble empirical mode decomposition with adaptive noise. In summary, the Hilbert-Hung transform is a flexible and adaptive time frequency analysis technique that excels in capturing the non-stationary and nonlinear characterization of signals. Its ability to extract intrinsic mode functions and provide high resolution time frequency representation makes it valuable in wide range of application, including biomedical signal processing. Researchers and practitioners can leverage HST to gain deeper insight into complex and dynamic signals behavior. Applications in biomedical signal processing. Time frequency analysis plays a crucial role in biomedical signal processing, aiding researchers and clinicians in extracting valuable information from complex time varying signals. Here are key feature applications of time frequency analysis in the biomedical field. First one, the heart rate variability analysis. HRV analysis assesses the variation in time intervals between consecutive heartbeats. Time frequency analysis helps identify changes in HRV patterns related to automatic nerve system function, exercise and cardiac health. Electroencephalogram EEG analysis. EEG recordings capture brain electrical activity over time. Time frequency analysis reveals brain wave patterns, aiding in diagnosing epilepsy, monitoring anesthesia and studying cognitive process. Event related potential analysis. ERP or brain responses to specific stimuli or events. The time frequency analysis helps identify and analyze ERPs, aiding in cognitive research and clinical assessment. Sleep pattern analysis. Time frequency analysis of EEG and other sleep related signals helps characterize sleep stages, detect sleep disorder and assesses sleep quality. Respiratory signal analysis. Analysis of respiratory signals such as airflow and thoracic movements helps diagnose respiratory disorder like sleep apnea. Fetal heart rate monitoring. Monitoring fetal heart rate and uterine contractions during pregnancy. Time frequency analysis assists in assessing fetal well-being and detecting fetal distress. Medical imaging enhancement. Time frequency analysis enhances medical images, providing the visualization of anatomical structures and abnormalities in MRI and CT scans. Pharmacological studies. Time frequency analysis of psychological signals assesses the effects of drug on the cardiovascular, respiratory and nervous system. Biological rhythm analysis. Analyzing circadian rhythms, ultradian rhythms and infradian rhythms helps understanding biological process such as hormone secretion and sleep wake cycles. Voice and speech analysis. Analyzing vocal characteristics and speech patterns used in diagnosis speech disorders, assessing neurological conditions and studying emotional states. Functional MRI analysis. Analyzing brain activity through changes in blood flow. Time frequency analysis helps identifying neural oscillations associated with cognitive processes. Cardiorespiratory signal analysis. Analyzing combined signals like ECG and respiration to assesses cardiovascular and respiratory interactions. Pain assessment. Analyzing psychological responses to pain stimuli assist in pain diagnosis, management and treatment evaluation. So, time frequency analysis provides a valuable toolbox for researchers and clinicians, enabling them to gain insights into dynamic psychological processes and improve diagnostic accuracy in various biomedical applications. Challenges and limitation of time frequency analysis. While time frequency analysis offers several advantages, it also comes with certain challenges and limitations. Understanding these limitations is crucial for effectively applying these techniques and interpreting the results. Here are some key challenges and limitations of time frequency analysis. Non-stationary of biomedical signals. Many biomedical signals such as ECG, EEG and blood pressure exhibits non-stationary behavior with their characteristics changing over time. Traditional time frequency analysis assumes stationary, which may not hold true in biomedical data. This can lead to inaccurate results. Non-sensitivity challenges. Biomedical signals are often contaminated with various sources of noise such as electrical interference or motion artifacts. Limitation. Noise can significantly affect the accuracy of time frequency analysis, making it challenging to extract meaningful information. Then artifact removal. Challenges for this is biomedical signals may contain artifacts such as a muscle movement, artifacts in EEG or motion artifacts in MRI. Limitation of this is removing these artifacts before time frequency analysis, since it is complex and may not always be entirely successful. Limited data length. Challenges. Biomedical data are frequently recorded for a limited duration, which can constrain the accuracy of time frequency representation. Limitation. Short data segments may limit the ability to capture low frequency component accurately in the time frequency domain. The next one, choice of time frequency method. The challenges. Selecting the most suitable time frequency analysis method for a particular biomedical signals can be challenging. Limitation. There is no one size fits all methods and the choice depends on the signal's characteristics and the research question, making it necessary to have domain expertise. Computational complexity. Challenges. Some time frequency methods, especially those with high time and frequency resolutions, can be computationally intensive. Limitation of this one, this can limit real time application or require access to high performance computing resources, which may not always be available in clinical setting. Data variability. The challenges is biomedical signals can be vary significantly among individuals and even in the same individuals under different conditions. Limitation of this one is time frequency analysis may not capture all relevant information due to this variability. Resolution trade-off. The challenges is achieving high temporal resolution may come at the cost of reduced frequency resolution and vice versa. Limitation of this is this trade-off can make it challenging to accurately analyze signals with a rapidly changing frequency component. Subjectivity in parameter tuning. The choice of parameters such as the width of the analysis window or the choice of Violette basis function often involves subjectivity. Limitation of is that different parameter setting can lead to different results, which may impact the reproducibility of finding. Now, I will conclude. Collaboration within the scientific community to establish best practice and benchmarks for the time frequency analysis. The future directions reflect the ongoing evolution of time frequency analysis, which continues to find applications in diverse fields from healthcare and geophysics to speech processing and beyond. As technology advances and interdisciplinary collaboration grows, we can expect to see even more innovation, application and breakthrough in this field. Okay. Thank you.